This is the sort of thing, actually, I like to do the most in the work that I do. I would like to pay my respect to the traditional owners of this land, fabulous lands that they are, the welcome that they have provided to us. It is great to see our Prime Minister today finally settling the Larrakia land claim in the Northern Territory, and we might finally come together as a country through all of our past, through all of our immigrations, as the one great country that we are. Often on the weekend, as I do on the weekend, I visit my elderly mother who's aged 90, and she asked me, where am I going this week? So I said, this week I'm going down to Albury. She said, is that another one of those mental health community events? I went, yeah, which is basically what I've been doing for the last 20 years. She said, do you think anyone will turn up? She's been asking me that for the last 20 years. And I go back and I say, Mum, hundreds turn up. She goes, yeah, I know. But that thing about mental health problems is so isolating, is so alienating. It's not a lack of empathy, but she grew up in a years and a society when people didn't speak. They didn't come out. They don't do what you're doing. They don't come out in the rain and stand there and celebrate the lives that we live and the communities that we live in. This is the remarkable change in Australia. I travel a lot around the world, but I much prefer to come home to places like this, because communities like this lead the world in their awareness around mental health problems, but more importantly, in their willingness to come out in these kind of conditions and be together. What's great about standing here is I can't actually see almost any individual face. All I can see is the community gathered together. It's kind of good to be gathered under umbrellas. It reinforces the idea, I think, of adversity. It's very easy to come together when we win, when we celebrate. We win a World Cup, we win an AFL flag, when we have things that are easy to celebrate. It's not so easy to come together in adversity. Adversity can be very divisive. It can make us very isolated. And there are very few human traumas, human tragedies that run to suicide. Suicide is a death like no other. Its impact on those around the person who has been lost is very profound. And as Nick so graciously shared with us, which is not easy to do, it's ongoing. The impact is not short term. And when we really need to come together is not just at the time that it happens, but in the days and weeks and years that follow. And that community thing is a community thing. Often it falls back on just the direct relatives, just direct family, parents and others. And there is a reluctance to actually come together in that adversity. What is so great about this event, and I realise it's the fourth year, is that persistence. And there could hardly be a better demonstration of that persistence than standing there this evening and actually participating, actively coming out as a community to support those who have been so dramatically affected. Just last year, I was sitting with a mum of a 13-year-old girl who'd suicided. Being the father of teenage girls myself, heartbreaking from my own point of view. And she asked the question, what more could we have done? I think as a family, there wasn't anything more that they could have done. The enduring question for me was, what could we have done? What could we as a community have done at two levels to prevent that tragedy, and then the even harder issue, to support that family on an ongoing basis? And I want to just touch briefly on those two things. I'm very grateful that actually the local member, Susan Lee and Cathy McGowan, are both here. Particularly Susan Lee, as the Minister for Health, is at the forefront of what is happening at the moment. There is a big change going on in Australia around suicide prevention. No matter what the outcome of the election in 10 days' time, I'm entirely confident that we are changing the way that we do things. We will see a significant investment in suicide prevention. But it's not the money that counts, it's the way that we do it. And for the first time ever, the real emphasis will be on what regional communities do. Which are the communities that are willing to come together and support each other along with the health services, along with the professionals, along with the new technologies to support those people in trouble. It isn't mental illness alone that kills. It's mental illness plus the isolation, plus the despair, plus the loss of hope. It is that situation that people with mental health problems expect, sadly, that the community will not be there. As Nick pointed out, not being able to speak, not knowing what to do in health and in adversity. The other big issue that will happen as part of that community movement in suicide prevention will actually be recognition of those communities. Right at the end, I'm really dying to take a picture of this and stick it on Twitter or one of those things and say, get your waterproof umbrellas and say, we're in. There aren't that many communities that are in. It's been my experience over the last 20 years, you'll mainly find them in rural and regional Australia. You'll mainly find, despite what people say, they are the communities that will speak. They are the communities that will come together. They are the communities that recognise who has been lost. And they are communities who don't forget. And it's the not forgetting and coming together which is so critical to the survival. There is a substantially increased suicide rate in those families and in those relatives and in those communities that have suffered a suicide. It is a major risk factor. The traumatic nature of the event is such that it is ongoing. So as we come together in difficult times, we need to have very much that political support. I'm absolutely confident the Prime Minister's made this clear again in recent days that we have it at the national leader level. We've had it back through John Howard, through Julia Gillard, through the current Prime Minister, and I'm sure through the current leader of the opposition. The national leadership is there. The model for doing it right is there. Get down to the community level. Find people like you to lead this particular movement, to support people before it happens, but also to make sure when it does happen that we provide the maximal possible support. So I am going to do a weird thing here. I'm going to put out this camera here in front of you. And I really, if I could just ask you, actually, all to put up your umbrellas at the same time. Just put them up in the air right now. So I'm going to use that in the future. And people say, have you ever been in a place where they want to be first? I can say, yeah, there's that place down in Albury. They're the community that bothers to come out on a night like tonight and say, we care, but we don't just care when it's easy. We care when it's hard. We don't just care in the preventative sense. We'll be there. We'll be there with each other when adversity actually strikes. Before the weather went really bad, I really liked the idea when Stuart asked me that you'd have it on the day of the winter solstice. I was sitting with a man today who's from the country in my office in Sydney, who's had a bad run of it in lately times. He's one of those people that actually gets depressed actually at the change of seasons, and he's struggling right at the moment. But the one thing we could agree about was from today on, he's likely to get better. And the most important thing is that he's still there tomorrow, actually, when the sun does come out, when things improve. And he made a really interesting comment that he's never made before in the 10 years I've known him. This time around, his family is there. This time around, his workmates are there. This time around, actually, the community he lives in cares. That's a remarkable change in Australia, and you're at the forefront of that change, and you are world leading in that, and I congratulate you on that, and it's remarkable the efforts that you're taking. If we can do anything at a national level to support you, that would be our honour. Thank you.